Hello everyone, this is Shadi Reis from CVI 2023. I'm really privileged to be with Dr. Vlad Dzavik, who has been an expert and passionate about left main and bifurcation lesions. Vlad, thanks for being with us.
It's great to be here. Thank you for having me.
Thank you.
On your interview.
Absolutely. So you have give a phenomenal presentation about left main and bifurcation.
Yeah.
So just enlighten us about what is the most recent best practice for left main approach.
So I think it's evolving,
Yes.
and there have been two schools of thoughts about two-stent versus provisional technique. The Europeans have been very strong proponents of provisional technique, and elsewhere, including here in Canada, where I'm from, I think we're much more believers in appropriate technique for the appropriate anatomy. Much of the benefit of a particular two-stent technique, the DK crush, has been, I would say, investigated and shown to us by one particular group, and that's Xiaoliang Chen's group in China. And all of the strong literature that we have is from those studies from China. So DK crush specifically has been shown by these investigators to be the optimal, the best technique, two-stent technique, even in comparison to provisional, especially in complex left main bifurcation disease patients. But that's just the problem, that all of the evidence is from that one part of the world. So we believe, myself and others, that we need to validate and confirm these results in other populations and by other investigator groups. So we're actually in the process of planning a study just like that, of validating DK crush versus the provisional approach in more complex left main and other bifurcation disease patients.
So from your experience and where the field is moving, for patients who had mid-shaft or ostial left main, there's no question about one stent strategy, IVUS guidance.
Well, I think IVUS guidance for all left mains. In fact, I would say for all complex, at least complex PCI patients. And there's no question, I think the evidence is pretty clear that PCI, even as opposed to bypass surgery, is the best approach for patients who have ostial or mid-shaft disease alone. That doesn't involve the bifurcation. Where you get into some controversy even between PCI and bypass surgery with surgeons is left main bifurcation, where the results, I think some have been somewhat controversial. And it should be said that all of the prior studies comparing the two modalities have been done with older techniques, I would say, that weren't as good as the techniques that we're using today. So I think that's what we want to show.
And all the studies based on the older technique and the equipment we have.
Yes.
Now we have better equipment.
Well, now we have better equipment, but more importantly, I think we know how to do it better than we did then. For example, the use of IVUS should be 100% in these patients. It was at best in the 40% range, even in some of the big left main versus PCI versus CABG trials, and of course even within PCI technique trials of two-stent versus one-stent.
Yeah. So from your literature review and for bifurcation, dual DK crush or two-stent strategy, I should say, what is the rate of revascularization in these patients?
Well, in DK crush, it's actually very good. You know, in 3 years, it's low, it's single digit, and that's very favorable. And these are actually patients with complex lesions. The important is appropriate preparation of complex calcific lesions by ROTA, by lithotripsy, by orbital, by cutting balloons, etc. Whatever you need to do, you need to optimize
the lesion before
the
you
substrate before you deploy stents, because once you deploy stents, it's more difficult to get a good result and then to get a good long-term result, because you set up the nidus for restenosis and for complications.
Last comment about the importance of POT.
POT is critical. In DK crush, multiple POTs are critical, but I would say in all of the techniques, it's important to do a POT after you deploy the stent into the main vessel if you're crossing over. And it's also important to do pod and DK crush after you crush the stent to make sure that it's completely crushed. It's important to do the pod after you deploy the main vessel stent over the crushed stent, and also most likely at the very end in all of the techniques to make sure that stent, that main vessel is as circular or as tubular as possible without eccentricity, and that gives the best results. So pod is a key invention from about a decade ago, but it's a very important one to use in all of the cases of bifurcation.
Well, Vlad, thank you so much for your time and for enlightening us about the techniques for bifurcation and left main intervention. Please watch these videos and others on CVI YouTube channel. This is Shadi Reyes from Austin. Thank you so much.
Thank you very much. It's a pleasure.